in massages for both the disabled and able-bodied athletes, and he has a wide variety of experiences with patients with different physical abilities. With no further ado, we call Ken on the floor, please.
Okay. I don't know if we're going to get feedback right there. He's actually talking behind who that guy is. I want to thank Mr. Venkat Ram for having me here today, and everybody here for their friendly hospitality, which means the food. This is a fantastic event. I've been trying to listen to what I'm going to be saying because I get a little bit nervous when I talk in front of people for different reasons, because you can see me, but I can't see you. But I haven't had a chance to listen a little bit. It's all very good information. Of course, my name is Ken Roche. I've been a registered massage therapist for the last 15 years. I've really enjoyed that since I graduated from the Canadian College of Massage and Hydrotherapy in 1996 with that year's highest academic average of 96.33. That does not necessarily mean that I am a better massage therapist because of my grades. That does mean that I loved what I learned, and I learned it very well. And I have heard some people might think because I'm blind I'm a better massage therapist, but I'd like to think that, and if it gets me better business, I would agree. However, I would like to think that anybody who's been learning and practicing for almost 20 years in physical studies like I have been, they would get to be very good as well. One of the first things that I noticed about massage therapy when I started looking into it about 18 years ago or so is its blend between art and science. Its art is based in Swedish massage, it's long effleurage, it's deep penetrating petrissage, but then it's blended with the Western philosophies of anatomy and physiology, muscles, tendons, ligaments, and joints, how they work and how they can work better. I think this is what gives massage therapists an advantage in the healthcare industry, because we try to incorporate the whole body in every treatment as much as possible. Of course, we must realize that we grow up and then we grow old, but we are constantly growing at every stage. Much like a tree in its youth, it's very flexible, as we were as babies. People say all the time, I wasn't born to be flexible. I wasn't born to do yoga where I could put my heels behind my head. I wasn't born to do all of these things. I'm too stiff. But in actuality, when we were born, we were very flexible. As a matter of fact, when we were born, our heels did go behind our head. Now, with time, aging, lack of proper influence, we've grown and adapted to our environments. There's one thing that we have to realize too. It doesn't matter if you smoke or if you run. Your body will constantly be adapting to its imposed demand. In training, we call it the SAID principle, or specific adaptation to imposed demand. So we have to realize that we have control over these imposed demands. And we have to take conscious control over these imposed demands, because your body is either reacting to the positive influences that we put into it, or it's reacting to the negative influences that we put into it, but it's constantly reacting to the influences around us. For example, I'd like to do a little bit of a demonstration. If you guys could just take your fingers and lock them together. So what I'd like you to do is notice which thumb is on top, which finger is on top. Now take them apart, close your eyes, and reverse that. Now listen to your brain scream as it analyzes all the information, as this is the wrong angles, the wrong length, and the wrong tension in the tissues surrounding each knuckle, each joint. It's a very simple change. Changing your postures, like we've already talked about with some of the life coaches, nutritionalists, we've talked about with the yoga. These changes take a long time to accomplish. These presets have taken a long time to put in there. So we have to recognize that we are influenced too by our habits and our actions throughout the day. So by sitting, many, many hours a day sitting at computers. These are all very influential things that are around us. And we have to at least recognize, become conscious of the fact that these are influencing the shape and the form of our bodies. Once we recognize that they are there, then we can say, okay, what is the exact opposite of that? Because that's as simple as it takes, is take a conscious effort of what exists and what is the opposite of that. And if I spend 8 hours like this, if I could spend 8 hours the exact opposite of that, then it would balance to being a neutral effect. But because we've put a negative influence on ourselves by sitting, hip flexors get short, neck flexors get short, head extensors, get shortened. And over a long period of time, just like an old cow, we become tough, leathery, and resistant to stretch. This negatively affects the joint's health and its functions. Some simple things that we can try and do. We've talked already a little bit about some stretching. I'm a huge advocate for exercise, but when we start talking about exercise, we say, well, I don't know if I have time for 3 times a week, 45 minutes, or my physio or chiropractor massage therapist tells me to take a couple of different exercises, do it 3 times a day, to do 3 sets of 10 repetitions. But these are principles that we can live better by. They're not just principles to get better by, these are principles to live better by. So if we can incorporate these type of exercise or activities into our normal daily living, then we can give it a positive influence over a long period of time, and that's what it's going to take. And I think that's one of the things you need to take out of this, because I've heard it several times already today mentioned that these are slow changes that need to take effect over a long period of time, so you're going to get the maximum benefits from them. So recognizing that we're sitting, all we have to do is stand. But that's not necessarily enough. If we can go back, then tighten up our stomachs as not to have the lumbar spine come too far forward to lose the stretch, then tighten up the hips. This is a very difficult and awkward position. I work in a rehabilitation center, and people often ask me, why am I stretching? Why am I moving? Why am I hanging off the desk to try and traction my back up? Because I'm growing negatively, and I want to put a positive influence into my body. But in society, if you go to a gym, if you're on a piece of equipment, if you're in aerobics on a mat, that's an appropriate place to do stretching and exercise. But because people are in the environment, I would suggest that the environment is an appropriate place for us to improve our positive influences to ourselves. Gravity, we're constantly affected by gravity, and we often think that it's a negative influence because it's constantly pulling us down. It's pulling our cells down. It's pulling our connective tissue down. It's pulling our muscles down. It's pulling our joints down. And the more we get out of alignment with gravity, the more it's pulling us down. But we also have to recognize that gravity is a positive influence as well, because gravity gives us something to fight, something that is tangible to realize that we're trying to hold something up against something. It becomes more evident with weight. And the heavier you are, the maybe more evident it is. Especially when you're out of alignment with it, because now you have to fight with it. But we also have to recognize that gravity gives us something to fight. It gives us something to challenge ourselves with. And we all know that we can mentally, by mentally challenge ourselves, we will mentally improve our marks in school, possibly our position in life, and definitely the work that we do and how we influence our communities. We also have to recognize that by challenging ourselves physically, we can improve our physical abilities to react and interact with our environment around us and the other people that are around us as well. So by recognizing that gravity is a force that needs to be reckoned with, both negatively and positively, we can change the line of force, whether it's getting on the ground to do like planks or push-ups, because we get very good at what we do. Gravity's pushing in a line straight down, so our bones get very strong linearly. However, this way, they're not as strong unless we challenge them in that fashion. So therefore, activities of daily living can and should include activities that allow us to do various active range of motions, which include moving every joint. It is very important that every joint moves every day. The synovial fluid or the lubrication that's in that joint gets dry. It gets sunk down because of gravity. As we move our hips around and around, that lubrication starts to get picked up and washed around. The hip socket, ball and socket is a ball. By doing hip circles, by doing hip figure eights, it's important to realize that we're just polishing that ball. Without doing that, articular cartilage gets dry. Eventually will start to scrape, and then it'll eventually start to gouge, and it'll have little burrs in it that starts to wear on the other side of it. With no lubrication, it has no oxygen, has no nutrition, has no chance for life. With lubricating the joint, moving it through an active range of motion, that also means that the ligaments, the joint capsules around them, have to have the extensibility. Muscles for good health, they want to expand and contract. And that doesn't matter if it's a big chest muscle, or if that's also just a little neck muscle, or if it's a muscle in your big toe. That muscle wants to expand and contract. And without a positive influence, it'll start to shrink shorter and shorter if it's in a shortened position, or longer and longer if it's in a lengthened position. So simply by looking at our negative activities, looking at the opposite, we can challenge ourselves by gently stretching. 30 seconds is recommended, minimum of 15-20 seconds, but to really increase range of motion, we really got to go like 30 seconds or beyond. We can either have an aggressive stretch where it's like, I could really feel that, or just a gentle stretch over a long period of time. Now we're talking 1 minute, 2 minutes, but it can be very, very gentle. It's putting in a positive influence that can happen over a long period of time. One of the benefits, I think, of massage therapists is I will talk to you about this while you are experiencing what I'm doing with my hands. I think it's a beautiful place for us to be into that, that environment of relaxation, semi-consciousness where you're relaxed, you get a chance to get away from your everyday influences. You're laying on a massage therapist's table. You're now no longer thinking about some of the external things that are pressing on your mind. You can experience something that's on a personal, I consider it to be a guided tour of self-discovery, where a massage therapist is working on your muscles, your bones, your joints, and you're like, I didn't know that hurt, or I didn't know that felt good. And you can start to distract yourself from all these other influences and start to focus on yourself. By gentle stretch, gentle contraction on a regular basis, especially by contracting muscles that are contracting muscles that are lengthened and weakened. The ones that are elongated by our natural activities. These are the ones that we have to consciously help as much as we can possibly. So with the shoulders being in like this, the ones that are on the back side are elongated and stretched because these ones are too strong. We have to consciously stretch, whether it's just squeezing your shoulder blades together, whether it's putting your arms out and trying to reach backwards and squeezing. Again, provides contraction on this side. It causes expansion on the front side. Both are important. We need to look at things like an equation. In mathematics, you do one on one side, you do the same on the other side, or the opposite to try and keep it equal. It's the same thing. We have to look at an equal sign, and we have to try and stretch the shortened sides. We have to lengthen or contract the lengthened sides. This is something that I would do passively or interactive with you as a massage therapist. While you're on the table, I might passively stretch out your chest, passively stretch out your neck. Ideally, a massage therapist would also explain why we're doing it and how you can do it yourself, because these are principles you can live better by, not necessarily something that you go to your physio, chiro, massage therapist and have them do it passively for you. It's something that you need to pick up on, and I'm sure we would say the same thing no matter who you go and see. It's very similar. It's just that we take different philosophies as far as how do we apply these techniques, but because we come from a similar background, some of the philosophies should be the same. Stretching 30 seconds, contracting 6 seconds against resistance, changing line of gravities, finding things like in your car that you can just gently push against. Okay, we talked about doing hip circles, and this is something that's very important. Think about that ball being a ball, but over time, with negative influence, without proper positive influence, that ball can become mushroom shaped. And because we're moldable and pliable in time, that mushroom will no longer act as a ball. So it's important that the younger you are, the more you can invest in a positive physical future. These are things that will build upon themselves, decrease your predisposer for degenerative changes to the muscles and joints that they help to move and correct. Negative or reduce your chance for arthritis, and help you feel better.